No, ma'am.
Okay. I think I had showed you the PPT, but I don't think I had animated the PPT. I think I had animated the PPT as well, because for your batch I had specifically done that. And the second thing that we had done was we had gone downstairs to the physio lab, and you had enacted the current flow in SWD. Do you remember that?
Yes,
Yes,
ma'am.
ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, I'll just transfer the meeting. I get the notification. One second. Okay. 2 more minutes for the meeting to start on the laptop. Okay, I'm logging off from this meeting. I'm logging off from my phone, and yes, I've joined. Yes, is everyone able to hear me?
Yes, ma'am.
Yes, ma'am.
Okay. You able to see the first slide?
Yes, ma'am.
Yes, ma'am.
Okay, fine. Right, so we had done this yesterday. We had done this, we had done this. Done, not done this. Okay, so I'm just continuing from this point. We are looking at this. Okay, and we are now going to consider this. So if I have to have the frequencies, if they should match, then the product of this inductance capacitance should match the product of this inductance capacitance. Is it matching right now? Oh, these are exactly 12 red dots in between the two paired electrodes, right? So 2, 6 are 12. Do we have that same thing over here?
No, ma'am. No.
Right? Therefore, the variable capacitor, this blinking part, is adding extra capacitance in order to equalize the product between the two circuits. Understood this now?
Yes, ma'am.
Okay. Can someone just say something?
Yes, ma'am.
Can someone
Yes,
just say
ma'am.
some? Okay, fine. Right. So everyone has understood this?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Easier to understand this concept now? Let's move ahead. So we were looking at these different methods of heating with SWD, and I added a small element yesterday, right? So when we are looking at the current, we are looking at the current moving from the negative point to the negative terminal to the positive terminal. It's an electron flow, the negative charges which move towards the positive terminal, right? So when that happens, okay, when this movement is occurring, you are going to get heat production over here. Okay, so these lightning bolts which are changing color, they are indicating the heat formation. Okay,
Yes,
can you appreciate the collision
Yes,
of
ma'am.
the particles?
Yes, ma'am.
yes, ma'am.
Okay,
Yes, ma'am.
the second thing that you have is the dipole rotation. Okay, so again, every time you get a negative charge, the dipole is going to rotate towards the charge, yeah, away from the charge. I'm so sorry. The positive pole is going to move towards the negative side, and the negative is going to move away from the negative charge. Okay, again, this is going to be in contact with the surrounding structures. Therefore, you are going to get collision and heat production again, right? Electron cloud distortion. The moment you have a negative to positive flow of charge, the electrons are going to shift towards the positive side. Okay, and these are all cyclical events happening very fast. 27.12 megahertz fast, 27.12 megahertz fast. Okay, so you are going to get a lot of cycling of the current, and therefore the heat production is going to be more or less constant. Okay, now let's look at the physiological effects of heat. Everyone okay till now, till this part?
Yes,
Yes,
ma'am.
ma'am.
Right? Let's look at the physiological effects of heat. Do you remember the effects of heat that you did in the first year?
Yes, ma'am.
Yes? Do I
Yes,
get
ma'am.
a resounding yes?
Yes, ma'am.
Yes,
Sure?
ma'am.
I'm hearing only a few voices since yesterday. What about the rest?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Do I get 40 voices all unmuting at the same time and telling me yes, we understand, we remember?
Yes,
Either
ma'am.
way.
Yes, yes, ma'am.
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Despite you remembering, we are still going to have a quick revision of what we have done the last year. So the first thing that we are going to look at is the effect that heat has on the temperature of the tissues. What is going to happen to these tissues? They are going to heat up. How are they going to heat up? Two methods quickly.
Conduction, convection,
Excellent. Conduction is through.
solid tissues or solid
Very good.
particles,
And convection is through.
liquid or fluids via fluids.
Yes. So what is the liquid that we have over here?
Blood flow through blood flow.
That is blood. You have got extracellular and intracellular fluid as well. Okay, so there are many sources for heat transfer over here. Okay, so whenever you start getting, you remember na, that when you place your hand across the electrodes, you start feeling a mild warmth. Okay, so even
Yes,
that much
ma'am.
warmth is enough for you to get this temperature change over here, and so you are going to get a lot of conduction convection happening within the tissues. Okay, now by its definition, this tissue is going this heat is going to be going to the deeper tissues, because we have already considered the high frequency nature of the current, and therefore we already know that whatever heat is going to be produced, I'm so sorry, that is going to be going right down to the muscle level. Okay, now when you have so much of an effect on the tissue, so when the temperature of the tissues increases, what is it going to affect next? It is going to affect the basal metabolic rate, which is basically the rate at which the cell is going to function. Okay, which law are we following over here?
Van Hoff's
Van
law.
Hoff's
Excellent, excellent. So we are following the Van Hoff's law, right? So you have got an increase in your cell functioning. What does that mean for us? Even if the cell is getting the good stuff, the cell is also going to throw out the bad stuff. What is this bad stuff going to do? These are basically metabolites. So what are
Facilitate
these
healing.
metabolites? They are going to,
vasodilation.
I'm sorry, I did not catch that.
All of this
Vasodilation.
facilitate healing.
Vasodilation. Why will they be doing vasodilation? This is Siddhi who is answering. And Isha, I will come to you in a while. I'm assuming that was Isha who was answering. So
Yes.
Siddhi, why will you get vasodilation because of metabolite formation?
The metabolites like histamine will relax the smooth muscle cells of the blood
Yes.
vessel.
Okay, that will promote histamine release. Okay, good. Isha, your point now.
Removal of waste products and supply of oxygen and other metabolites will increase
Yes.
the tissue healing.
Yes,
That's
but
it.
that is going to happen later on when your blood flow has increased. When you are first, when the rate of your cell increases and the metabolites are going to be thrown out, what is the first thing that they are going to do? Vasodilation and removal occurs much later. They're going to increase the inflammatory process over there, which means they're going to increase the pain causing factors over there,
Yes, ma'am.
right? So with the good comes the bad, and therefore comes the next point, which essentially Siddhi has already explained. Okay, so you have got histamine release by the metabolites themselves. Added to that, you have got the vasodilation occurring because of the heating effect. Okay, yes,
Yes, ma'am. Ma'am,
yes,
the first response will be vasodilation, right? Due to heat, which is a protective response.
yes. All these things are going to happen in tandem, they are going to happen together, they are not isolated as such.
Okay, ma'am.
Okay, they are not isolated. You cannot say that heat is going to, we cannot say that heat is going to first act on the cell, then on the blood vessels. No, it is going to act everywhere indiscriminately. Okay, so the same time that the vasodilation is occurring because of the heating effect, at that same time you are going to get increased cell metabolic rate. At that same time, you are going to get an extensibility of the collagen tissue. I think I should talk a bit slowly. Okay, so you are going to get everything happening together. They are not happening one after the other after the other. Why are we putting it this way? It is so that we will be able to understand uh, the process much more easily. So we will be able to apply the concept and the principle easily. Okay,
Yes, ma'am.
that is the only reason why we are looking at it in a particular kind of a sequence. But these processes are all going to happen at the same time. Okay,
Yes, ma'am.
right? Okay, so essentially, you have already told me that you're going to get vasodilation. Now, the causes for vasodilation are multiple. One is the vasodilatory effect of heat. The second is the vasodilatory effect of that histamine which is being released. Okay, right? Third, since the cell metabolic rate has increased, it is going to require a lot of blood. So therefore, there is a reflex vasodilation your nerve conduction has increased, therefore there's a reflex vasodilation. So multiple factors are going to have an effect on the blood flow. Okay,
Yes.
understood this, right? But the end point of all this is that blood flow to that area will increase. Okay, now that is beneficial for us in different ways. One, because the cell is going to require that much nutrition, it will have it readily available. Two, at the same time, you will get that washout of metabolites, like Isha said, correct? Three, now we are looking at the healing part of the tissue. If the cell metabolism has increased and the functioning of the cell has increased, it will have an increased capacity to promote healing, correct?
Yes. Yes.
In that region. So your healing capacity has increased, right?
Yes, ma'am.
Then when you are looking at the tissues by themselves, the collagen extensibility is going to increase. Now later on, after your treatment has stopped, SWD, and you take that
Yes.
patient in for exercises, because this is an adjunct therapy, this is not an individual therapy, this is an adjunct. After your SWD you will always be providing exercises, correct? So when you give those exercises, these effects are still in play, because heat loss has as yet not occurred in those tissues. Okay, the heat is still, the temperature of that region is still slightly increased as compared to the rest of the body. So therefore when you are giving exercises for that specific region, your muscle work will be much better.
Yes.
Understanding this,
Yes, ma'am.
everyone?
Yes, ma'am.
Yes, ma'am.
Okay, do do we need everyone to unmute themselves, because I'm really not getting a lot of yeses from all of you. I'm not really understanding whether you are getting this point or not. I'm not
Understanding, ma'am.
understanding whether you are.
Understanding, ma'am.
Yes.
That
Understood,
is the
ma'am.
Yes,
third
ma'am.
point.
Yes, ma'am.
Four, five. I have 40 students. Of 40, only 5 are answering. Okay. There is another way in which I will understand whether or not you have understood, and we will follow that method after this lecture is done. Okay. So
Yes,
you
ma'am.
are going to get an you're going to get an improved functioning of the tissues of that region after the treatment is done. Okay, now nerve conduction. I think all of you know that heat is going to increase the nerve conduction. All the processes are going to speed up, therefore nerve conduction also speeds up. But at the same time, heat provides a sedative effect. Okay, because the impulses are carried faster, the pain carrying impulses are what is the name, what happens to the pain
A
carrying
delta
impulses, they
C5.
are, sorry, what happens to the pain carrying impulses? You have got a beta, a delta, c fibers. So a beta fibers are going to improve in their conduction much more, because they are thickly myelinated fibers as compared to a delta and c. So impulses are going to be blocked, gated. पेन गेट मेकॅनिझम झालंय तुमचं.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
So you should know this concept. Why are we getting this sedative effect? Because the pain is getting blocked, right?
Yes.
Yes, ma'am.
Now overall relaxation झालेला आहे. Overall all these muscles are relaxed now, the spasm has relieved. So therefore you are going to get a nice sedative effect over here. Yes or no?
Yes,
Yes, ma'am.
ma'am.
Yes,
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 ma'am.
ma'am.
Yes,
So
ma'am.
if you are going to get a sedative effect, is it good for us or bad for us?
Good for us.
Yes, it is good for us as the therapist. Okay.
Hmm.
because we know that our treatment was effective. Okay.
Yes.
So you have got multiple effects on nerve conduction as well. The first thing, conduction velocity increases, decreases,
Increases.
increases. Very good. So thickly myelinated nerves are going to have carry impulses much faster as compared to thinly myelinated or unmyelinated fibers. Okay, which means your pain is blocked over here. If your pain is blocked, your muscles are going to relax. If your muscles are relaxed, the spasm is gone. Again, pain is reduced. Okay, and all this along with the heat itself is going to lead to a sedative effect. Okay, so understanding how
Yes.
things are occurring.
Yes,
Yes.
ma'am.
Good.
Yes, ma'am.
We move ahead now. Now that we have looked at the effect, the physiological effects are going to dictate the conditions that we are going to treat. Okay. So
Yes, ma'am.
can you apply the physiological basis for treating these conditions now?
Yes.
Yes.
Yes, ma'am.
Sure.
Yes, ma'am.
Yes. Yes, ma'am.
Should I ask someone?
Yes, ma'am.
Hmm. Just one second. Just one second. Hello. Oh.